Welcome. I'm going to call to order this special called meeting of the Johnson City Board of Education. We always start our meeting with a moment of silence. If you would join me in a moment of silence. Thank you. Dr. Barnett, will you lead us in the Pledge of Allegiance?
Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. The purpose of this meeting tonight is to discuss current numbers of COVID-19 in our schools, to clarify some protocols, and to take any necessary action. I want to thank you. We've heard from a lot of you. You've shared your thoughts and your concerns, and I want to thank everyone that took the time to do that. I would ask that you respect this as a time for the board to meet and conduct business. And we appreciate everyone being here and everyone watching online. I'm going to turn the meeting over to Dr. Barnett.
Thank you. Thank you to everyone who's here tonight. We had some concerns about our protocols and wanted to make sure that we reviewed those protocols and we're very clear with the protocols that we have in place for our schools. So we have those on the website now posted very clearly. There were some concerns about one of the options that we had used was sending a letter home when there was a case of COVID in a classroom. I think that probably just caused more confusion than it helped. So Dr. Wallace, if you'll come forward, we're going to review those protocols so everybody's clear about it. I think it's really important that everyone watching is able to hear that as well and understands those protocols and understands what our protocols are in each of our schools and has a very good understanding at this point in time the number of cases that we actually have in schools, because you'll get concern from a school that maybe we're not as concerned about right now, and then we'll have concern from other schools that are lack of. So we want to basically clarify what's going on in the schools and what our protocols are.
Thank you, Dr. Barnett. I think we should start by saying happy birthday to Miss Hall and Miss Treese. So it's her 31st birthday, I think, for both of them. So we're
and they did this to celebrate their
birthday. Yeah, that's what we all want to do.
But
so, Dr. Barnett, thank you, board. Thank you so much for the opportunity to come speak with you. As Dr. Barnett mentioned, we did have some questions last year, as you will recall. One of the things that we think that we did very well was we were able to take that packet and provide that to the principals, and it had some very clear cut. Here's what you do. Here's what you don't do. If they had some additional questions, they felt free to call us and we could clarify for that. Certainly at the end of the school year, when things seemed to be winding down from a COVID standpoint, we had made the decision to relax some of those protocols going into summer. We initially thought that that would be a good plan moving forward. Obviously, the numbers have spiked. So we wanted to revisit that and certainly give our principals the tools that they need to make sure that they're running their schools safely and effectively. So to kind of start out just specifically on the numbers, for Johnson City School or for Washington County school-age children, on the 3rd of August, there were 50 students. On the 5th of August, there were 65 school-age students. This is all of Washington County. On the 10th of August, there were 97 school-age children. And on the 12th of August, there was 137 school-age children that were positive to COVID. Our current positivity rate is 15%. And I'll remind you, last year on the 25th of August, we had 22 positive cases of students in Washington County as a whole. We are currently, according to the White House Coronavirus Task Force, our current status is high transmission, which is red, which is the highest level. We also, that, as you know or probably know, is a product of two factors. One, the positivity rate being above 10%, and the number of positive cases per 100,000 over a 7-day period. Our latest numbers at our individual schools, From Science Hill beginning at the 6th of August to now was we went from 2 to 17. This is faculty and staff. Liberty Bell went from 6 to 18. Indian Trail went from 4 to 29. Cherokee 0 to only 2. Fairmont 0 to 6. Lake Ridge 0 to 3. Mountain View 2 at the beginning, 1 currently. North Side 1 to 6. South Side 1 to 0. Town Acres 0 to 3. Woodland 1 to 4. Topper Academy 1 to 5. We have a total of 82 people currently positive in our school system. That's updated regularly twice a week on our dashboard. So with that in mind, we had an opportunity to look at last year's protocols, edit those a little bit, and put those out on the webpage. As Dr. Barnett mentioned, anybody can find those. So to walk you through those specifically, return to school in person, all desks will be arranged to face in the same direction toward the front of the classroom and provide as much space between them as possible. Mask as recommended by the board last board meeting, masks are recommended by Johnson City. Teachers may wear an appropriate mask which covers their mouth and nose and or a shield and maintain 3 feet of spacing between themselves and their students as much as possible. Teachers will not need to wear a mask when they are teaching from the front of the room or in small groups when appropriately distanced. We wanted to especially make this clear when it came to teaching things like phonics. We know that that's certainly an area that we noted was an area that we felt students just need to see your lips.
I understand your enthusiasm, but please, can we keep quiet and let us meet?
Appropriate masks will be provided for any student or staff when they're requested. We currently have about 250,000 masks still available, paper masks. So we're in good shape. A lot of people provide their own masks, but we have plenty of masks currently available to us. Classroom windows will be open when possible and when conditions allow. Teachers may utilize small groups and centers, which is a difference from last year, as long as that is consistent with their seating chart. So we want to be able, one of the things that we'll talk a little bit about in contact tracing is to try to impact the minimum amount of students as possible. So we want those groups to be consistent with the seating charts. And our movement of operations, flow of foot traffic within the building should be directed in only one direction when possible. That's not always possible in all of our schools. If one way is not possible, hallways will be divided so that students can go in the opposite direction on either side. Staggered movements of groups at incremental intervals will be used when feasible to minimize the number of students and people in the hallway. Teachers should use all appropriate green spaces and play areas when taking students outside to help support social distancing. So protocols for screening students. As we became aware last year, I think probably the least effective was the temperature screening as students came into school, and the CDC does not recommend temperature screening for students. And if we were to do some screening, we'd certainly make sure that we provided the privacy of HIPAA. Students are allowed to enter the building at the designated area and must egress from other exit to keep traffic moving in a single direction. Parents and visitors are not allowed in the school building except prior appointments. Adults entering the building will wash or sanitize their hands. Now, we're going to talk a little bit about parent volunteers here in a moment as well, but we don't want a lot of visitors in the building. Any volunteers working with students will be required to wear a mask. Strict records will be kept, including day and time when all people are entering or exiting the building. We obviously have the capacity to do that through our Raptor program that states the time, place, the amount of time that they were in the building. Parents should check their students' temperature every morning. We would hope that goes on anyhow. With scanners or student with the temperature of 100 degrees or above will stay home and consider coronavirus testing if no other explanation is available. That is consistent even prior to coronavirus. Students with 100-degree plus temperature would be asked to be taken home. Parents will monitor any cough, congestion, shortness of breath, or other gastrointestinal symptoms every morning. Any positives will require parents to keep the student home from school. Children who become ill at school will be placed in our area of isolation. The nurses will wear their appropriate PPE when caring for these students. When a student returns from school after an illness, they will check with school administration to make sure that the proper communication has been made with health officials. Our testing protocols for students and responding to positive cases. Students who develop fever or fall ill at school will be kept in an area of isolation so they can be transported off campus. They will be transported by a parent or ambulance if they're clinically unstable for off-site testing. If any student tests positive, immediate efforts will be made to identify any close contacts, those 15 minutes or in close proximity of the student. Information about close contacts will be shared with the Tennessee Department of Health, Northeast Regional Health Office, which will determine if a contact are required to quarantine. Now, we'll remind you that we do not quarantine. We can exclude based on the recommendation of the health department. At this time, testing of all students in the class is not recommended. We do not mass test students. We have that capability to test students if a parent provides that permission. Parents will check their students' temperature every morning using temporal scanners. Students with temperatures of 100 degrees above will be asked to stay home and consider coronavirus testing. Parents will continue to monitor their children for cough, congestion, shortness of breath, and other gastrointestinal symptoms every morning. Any positives will be asked to seek out further testing. Dining, this is exactly, I met with Ms. McGaughy, this is exactly the same as it was last year in our protocol. School system adults will be allowed to enter to eat with their child, but only in their designated area, separate from other families or children. Parents and guardians may leave meals at the front of the office for their student. Students may wear appropriate masks that cover their mouth and nose while they're in the cafeteria. Certainly not expected while they're eating because that would be impossible. Efforts will be made to decrease the number of students in the cafeteria. I know Dr. Barnett had a phone call with all the principals last night individually, and they all thought that that was something that they could work to support. Students and teachers in cafeteria will wash their hands frequently before and after every meal. Students may bring food home from home, of course. School supplied meals will be served through the serving areas with disposable utensils. Serving lines will be sanitized after each student. Meal times will be staggered to create seating arrangements of 3 feet of distance. And actually that should say when possible, because that's not going to be possible.
And I think that really means each class, when each class comes in.
Disposable utensils will be used and employed, and presented per child instead of children reaching and selecting them for themselves. Serving and cafeteria staff may use barrier protection, including gloves, face shields, and surgical masks. Open selections of foods like salad bars, self-serve stations will be closed, manned by an adult to avoid multiple surface touches. Selections of food will be monitored by an adult to avoid multiple surface touches by methods recommended by public health officials. Our gatherings and extracurricular activities. Students and teacher will wash their hands obviously before and after each event. Off-site field trips are discontinued. We actually haven't reinstated those yet. That's consistent with last year. Inter-school activities may continue if bus transportation is provided, and students will wear a mask throughout the transport period. Schools may elect to discontinue activities if community transmission rises. After-school programs may continue with optional face masks. Schools may elect to discontinue these activities if community transmission arises. Protocols for athletic activities. This is pretty easy. We're going to continue to follow Tennessee Secondary School Athletic Association guidance. Personal protective equipment and cleaning protocols. The use of these physical distancing measures is designed to create layers of redundancy, recognizing that students are unlikely to be able to maintain full compliance at all times. They are designated to minimize the risk of transmission as much as possible while still allowing feasibility, flexibility, and ease of use. Use of personal protective equipment and hand washing. All staff and students may wear appropriate face masks. Staff and students may provide their own mask, and masks may be made available for those who need one. Mask must be appropriate and will be worn to cover both the mouth and the nose. Students will wash their hands and use hand sanitizer after changing classrooms. Students and teachers will schedule hand washing with soap and water every 2 to 3 hours or when practical. Gloves are not required for janitorial staff or teachers when cleaning their classrooms. On our cleaning protocols, very similar to last year. Coronavirus on hard surface can survive for hours. Exposure to sunlight and higher temperatures is expected to diminish their survival, but the exact amount of time required remains unclear. At this point, more aggressive cleaning practices are recommended in order to err on the side of caution. Routine cleaning with standard soap and water will remove germs and dirt and lower the risk of spread of SARS-CoV-2. School campuses will undergo cleaning on a daily basis. Frequently touched surfaces, including light switches, doors, benches, bathrooms, etc., will undergo cleaning with either EPA-approved disinfectants or diluted bleach with a solution of 1/3 cup bleach and 1 gallon of water, at least twice daily. Library, computer labs, arts, and other hands-on classrooms will undergo standard cleaning procedures per normal operating status. Student desk may be wiped down with either an EPA-approved disinfectant, or it should say with bleach as well. Our busing and student transportation, as we referenced at our last meeting, CDC made a recommendation. We looked at the guidelines for any federal transportation. We sought out legal advice, and they felt that school buses fell under that mandate. There will be obviously an anticipated increase in car rider traffic. Please allow for additional drop-off time and pickup locations. Our principals are excellent at that. Appropriate face masks will be worn by all staff and students. Masks will be worn to cover both their mouth and nose. Windows will be open when possible and conditions allow. Unloading and loading of buses will be staggered to minimize mixing of students as they enter the school and to allow 3 feet of distance while entering through designated areas when possible. Seats and handrails will be wiped down with either an EPA-approved disinfectant or diluted bleach solution before and after every ride. And then the conclusion there just talks about these are consistent with the framework to implement a safe and efficient, equitable return to school. And we continue to consult with our health department. It's just a standard statement of conclusion. So those are our protocols. You also have had an opportunity to review the return to school algorithm. So I think there was a little confusion about the return to school algorithm because we've been talking about quite a bit that we're still following the same symptoms-based program. One major symptom, 2 minor symptoms. They had to follow that process to return. We said there were 3 ways to return. Basically, they could have an alternative diagnosis from their physician. They could have a negative test from their physician, or we could provide with parental consent a negative test for them. And if it was negative, they could return after the resolution of symptoms. The question really came to if you had somebody that was deemed a close contact and how they return. So we made sure that we posted on the website as well the protocols for schools assisting public health with close contact identification for COVID-19. And I think, Ms. Hall, I should probably stop right here for a second and ask if you have questions in general about the protocols, and then I can talk a little bit about the contact tracing.
Any questions for Dr. Wallace?
I have one.
Yes, ma'am.
When a child gets tested at school, does the parent have to be present?
It's a great question. So, because I think there's been some confusion about what we do. So no child can be tested without parental consent. And there's not a blanket consent. That's anytime a child is tested, they have to have parental consent. We have asked, and we've been consistent with that, we have asked that if we're going to do the test, it'd be great if the parent's there, just because it's in some levels protection of the nurse. We didn't want someone to say, you were too rough, made my child's nose bleed, but they do not have to be there. It's just recommended that they be there. If somebody's busy and they say, can I fax in my consent? We absolutely can do that.
The test itself is, I had one a long time ago, and this one, they run way up in the sinus. This is more of a, just inside the nose.
Yes, it's pretty painless. I've had one. Any other questions about the protocols as we've run through this?
On the return to school algorithm,
Yes,
on the return to school algorithm, I think we need to be clear about a few things on that. Is 2 sides of that, and the issue of quarantines. You mentioned that the health department is responsible for quarantines. What we do is we work with the health department and we communicate with the health department if someone is deemed a close contact. One of the changes in the algorithm from last year to this year is, so if you have a class full of students and somebody has COVID and Mr. Williams, I have COVID, Mr. Williams is sitting with me, Ms. Hall's sitting next to me, and you all find out I have COVID, so you're both close contacts. If you have a mask, if you are wearing a mask, you do not have to quarantine. Is that correct? If you're asymptomatic.
That is correct.
So that is one of the ways back into school or to stay in school. And that's why that's a really important thing to point out on that.
Yeah. So actually, Dr. Barnett, I can just go through, there's several reasons why somebody wouldn't be. So we could deem them a close contact and they wouldn't be quarantined.
Before you get into that, so I think there has been some confusion with letters coming home. So if you are a close contact, is the communication you get different than if there was just someone in your classroom?
That's the reason I mentioned that. It was not to make a statement about masks. It was to point out the fact that there is a change in the return to school algorithm. And we were sending a letter out that we were going to do phone calls to parents because that's a much better way to facilitate that.
So you're changing from a letter to a phone call.
To a phone call because it's just, we can't always do that. But if you're a direct contact, you're going to get a phone call from the school to tell you that instead of a letter. Because the letter, there's a delay, and that's been frustrating for a lot of parents, I'm sure. It was a close contact on Friday, and I got a letter on Monday. We need to go back to doing those phone calls.
Yeah, and this whole part of that is a result of changing the way we did our protocol. So we were very active last year in the contact tracing, obviously. And I will mention again what I mentioned at our last board meeting. One of the things that we are very proud about, the fact that we were able to stay in school more than most districts around us, most districts across the state. We're very proud of that. We were able to keep students in school in part because the great job that our nurses did in kind of breaking those out. And I'll just give you a real quick example. Because it was our people doing it, and we would go pull charts and we'd break those situations about. We'd have those conversations with the health department. And we were able to give specifics, and then we might see the link that may have been something that was outside of school. And rather than just look at a hard black and white, well, that whole class needs to go home, which we saw consistently in other districts, we were able to say, no, we feel very comfortable and confident that it only affected this group of people. So our goal, obviously, is to minimize that. So part of what we started this year was a very different process where we weren't directly supporting that process, but we're going to return to that because of the confusion. So we will be helping, again, identify those direct contacts. If the health department deems them a close contact, then we will exclude them from our school.
Okay. So we feel that it's going to help us keep more kids in classes. You know, our goal is to keep students healthy, do this as safely as possible, and it always is, and to keep students at school where they should be learning.
Does that answer your question?
Pretty much. So in Dr. Barnett's example, so Mr. Williams and I are close contacts. Mr. Hager, who's way down there,
He's not a close contact.
Is he going to get communication if he was in the same class?
This
is our classroom.
He would not. Now,
Okay.
What we may do in some situations, if we have emerging numbers in a group, we do feel like that's important for parents to know and get to have that opportunity to make that decision. But that would be something that would be
So if
communicated.
there seems to be in a classroom, if there seems to be some spread within a classroom, you will probably let the parents know. But if there was not a close contact,
That's correct.
they won't
That's
necessarily.
correct. You don't need to know in that case. So Mr. Hager, sorry, you will not get a letter, but the other two.
Or a phone call.
Or a phone call.
Dr. Wallace, I have
Yes,
a
ma'am.
question.
Yes, ma'am.
So using Dr. Barnett's example, which was a good one, for the close contacts, let me make sure I understand this right. So you would notify the health department. It would be the health department's decision about the quarantine,
That's correct.
but the school policy is they can choose to self-quarantine?
No, we would be excluding those folks.
We would be,
Similar
they-
to what we
The
did
health
last
department,
year.
They're quarantined.
Similar.
Okay.
Yeah, we're notifying that they have been identified as a quarantine, and then we would enforce that process.
And then obviously their schoolwork would be available for pickup and.
That's it. We would have, we feel very comfortable with grades 3 through 12. We have the ability, because of what we experienced last year, to continue learning from home. The K1 and 2 students, we feel like it'd be really important. We're in the process of identifying or hiring some additional staff to help facilitate, if we need, to have that opportunity for students to continue their education while they're on quarantine. Or if, there's situations where parents know there's a case in the classroom, they self-quarantine to continue that education. One of the things we cannot do this year is to set up a remote learning model that we had last year. So we have the virtual school for grades 5 through 12. That was planned before COVID. It's in place. Feel like grades 5 through 12 are really, that's an age group where you can learn, you can read to learn. Below that, we question the feasibility of doing virtual school for younger children. So we made that choice not to have that as an option. So we're going to offer that while they're on those short-term quarantines. We're going to make sure they continue their education.
Could you explain the concept of quarantine present?
Sure. You have a student who, currently you may have a student who was a contact, so they're quarantined. We count them present because we're going to continue their learning at home. They're not sick. They did not go home because of illness, and we're really trying to keep those at a minimum. But we do feel like we've got to continue to allow them to be present so it doesn't count toward their attendance as well.
But even if they tested positive and that's why they're quarantined, they can still be
They can
quarantined
still
present. They can be
quarantined
counted
and
as
move
present
forward.
and
Mhm.
continue their learning.
When you would be absent is if you were actually sick and couldn't do your work.
We haven't currently done that yet, right?
No.
Correct.
Mm-mm.
So we don't know how many kids that's going to be going forward, right?
That's right.
To stay on quarantine, I'll just remind everybody, for the purposes of anybody that has forgotten, there are 3 basic ways to return from quarantine. That was updated as we continue to go throughout the year. There's the standard 10 days that people can return. They can return on day 11 if their symptoms have been reduced or are gone. There's the 7-day option, which after 5 days, if they're completely symptom-free, on the 6th day, they can be tested and return on day 8. Or obviously, there's what I think the health department would deem the gold standard, which is the 14 days. So any one of those 3 in that quarantine process is an opportunity for them to choose when they would come back. So.
And that you're saying quarantine, not in isolation, correct?
That's correct. That's correct. So back to the other reasons for contact tracing where somebody might not have to be removed. Dr. Barnett mentioned mask, which is an addition this year that was not included last year. So if somebody's deemed a close contact and they're wearing a mask, they would not be deemed need to quarantine.
Unless they have symptoms.
Unless they have symptoms. They have to be symptom-free, and that's true in any case. So all of these, whether you've been vaccinated, not vaccinated, if you present with symptoms, then you would go into that return to school algorithm regardless. If somebody's had COVID in the last 90 days, that would be covered. If somebody's fully vaccinated, again, without symptoms. And then we mentioned if the issue with the mask. So those would be 3, again, a little bit more flexibility in the contact tracing than what we had last year.
And that's from the Tennessee Department of Health
That is correct.
return
That's
algorithm, not the Johnson City Schools return algorithm.
Yeah, and just for accuracy, it's protocols for schools assisting public health with close contact. And it's listed on our webpage as that as well. So,
Dr. Wallace, one quick question.
yes, ma'am.
Sorry. Following that same analogy, so Ms. Hall has a mask on. Steve is COVID. Robert here does not. What letter, phone call? What
Phone
goes
call.
on with
It'd be a
him?
phone call.
And what will that say and respond?
that he's been deemed a close contact through the Department of Health or Tennessee Department of Health. We'll be excluding him, and then we'll explain those options on return.
When you say excluding, he's being sent home to quarantine.
Sent home quarantine. That's correct.
Possibly. But there's those other options that could possibly
Correct.
keep him out of quarantine.
Correct.
So there's a process they have to work through.
Dr. Carter had a question.
I have two questions, and I was trying to, I don't think we have that. Did you say 3 feet or 6 feet?
So we're talking 3 feet. One of the things that's going to be different this year regardless, as all of you know, we have a significant number of students, more students in our buildings than we had last year. So 3 feet is what the APA recommends. 6 feet, you hear 6 feet, you hear 3 feet. 3 feet's the number that we're going with. And even that, Dr. Carter, we're saying when possible. We recognize, I mean, we're talking about students and being able to keep them separated is difficult, obviously.
And then the other question, do you know if our local health department is going to recognize an antibody test to be excluded from quarantine?
I have not heard any discussion about antibody tests for exclusion for quarantine.
And that would, I guess you're deferring
They-
that to
they
them because
would-
they're the ones at quarantine.
Yes.
Not
That's correct.
Yes, that's correct. And I feel confident, Dr. Carter, that if that became an option, they would let us know immediately. So
Dr. Wallace, will you explain the vaccination again, if that gets you out of quarantine or not? Can you clarify that?
the vaccination, if
Yeah,
you're
status.
if you are symptom free and you've been fully vaccinated, 2 shots or 1, if it's the Johnson & Johnson plus 14 days, you would not have to quarantine if you're symptom free. So that's the new information that we've provided that's been updated on our webpage. We just felt it was important, certainly, since there was some changes, and to provide some clarification. If you have any additional questions for me.
I don't see any, and so our principals are all aware of these changes.
They were emailed this information today. And
It is on our website. Are we going to do anything else to communicate with parents what these protocols are?
I think we could certainly push it out. Colin was here. We could certainly push it out. And I know Colin
We'll do
did,
that.
one of the things that Colin did differently this year, it's not only on our homepage, but it's on each school's homepage as well. So if somebody's just going to their individual school's homepage, they would be able to find that information as well. And of course, we have it here.
The scenario was really helpful. I wonder if a scenario might be helpful to parents that didn't watch this and look at
Sure.
it. There is a principal here who really likes to do some videos. Maybe he could be recruited to do a video, but
Sure. Well,
I didn't.
any other questions for me?
We left one scenario out. There is a person who tests positive, has the mask on, and the 2 people next to him now.
You can go ahead and answer that. if you-
What in that scenario?
It's the person that tests.
Again, I
that would
ask
be
you to
the same.
be respectful of our meeting.
Again, that would, go to the health department.
That would go to the health department. We'll discuss it with them.
You're not the parent. Parent choice.
Could you please respect our meeting? We will not allow any more disruptions.
Do you have any other questions for me?
Any other questions for Dr. Wallace?
Thank you.
Thank you all.
Any discussion?
Well, I'd like to make a comment. I just, one of the things that Dr. Wallace said was that these are layered approaches. And we want to create as many layers to keep our kids safe as possible. And I want to thank all of our community members who have reached out to all of us via phone, email, and text. It was a lot of emails, and we appreciate it. And I'm really thankful that we have a community that puts their children first. That is a really big deal, and I'm proud of that. The first statement in our code of conduct says that I will at all times think in terms of children first, always determining other important things according to how they affect the education of children. And I think everybody here wants children first. So I think that can mean a lot of things. That can mean that we make sure we have HVAC upgrades. It can mean we have qualified teachers. But tonight it means, what are we doing to protect our children in the face of a health crisis? And most people are here because of masks. That's the question. I've had over 100 emails. I have a stack of emails here. These are the emails of people who would like to have mask mandates. These are the emails of people who would not like to have mask mandates.
Where are they?
We don't see them. They've been censored.
Madam Chairman,
Yes, Mr. Hager?
this is a public meeting. I respect everyone that's in this room. Please respect us. Your shouting out does not help anything. The next time there's an outburst, I'm going to make a motion that this meeting be terminated. Please respect us. We're sitting up here respecting you. So please be quiet.
Thank you, Mr. Hager.
We've had a lot of emails. So we've heard from doctors and public health educators begging us to implement mask requirements. We've heard wrenching emails from parents who have children or family members who are immunocompromised. Our city has implemented a mask requirement. UT Knoxville campuses will also begin semester with mask requirement in classroom, laboratories, instructional spaces, and indoor events. And any indoor events students are required to attend. Milligan College is requiring masks inside building. ETSU is requiring masks inside building. The local health system has asked us to require masks indoors. Other area doctors have asked us to do that. Masks are one layer in the prevention of the spread of COVID. But masks work best when everyone is wearing them. We should put our children first and require all people in our building to wear masks. Protecting children and families and doing everything we can to keep our kids in school is what we need to do. It's not popular, it's clear. We may have the state legislature after us, but I really appreciated the quote in the paper by longtime Greenville City School Board member and surgeon, Dr. Mark Patterson, that said, "I understand the political pressure on you, but remember the health and well-being of our children is your responsibility. Don't abdicate that. Kids are first. Their health and well-being is our responsibility as board members. Be willing to take the heat for those that you are in charge of." I'm willing to take the heat. I think the kids are worth it. I motion that we require masks for all people in all of our buildings.
Okay, there's a motion on the floor. Is there a second to that motion?
I second that motion.
Okay, there's a motion and a second. Any discussion?
Yes, I think I would echo what Beth said about the communication from the community. And there are a lot of emails, but I would also say if it was like to say one was over the other for emails, I think walking into the schools has demonstrated what parents have chosen. And although, but if you would, it is not a decision for me about pressure, politics, or anything. It's a decision that I think that parents are the people to make decisions for their children. And just wait. And now we are so far into COVID. I mean, we're 18 months into it. And I think at first everyone was, doing whatever we can. But there is data on, for if you show me this study, somebody shows me another study, and we got presented with a lot of things. So there are studies that masks are ineffective. There are studies that think they are effective. Like I said, I've had pulmonologists and other doctors, but I think the question is the child's doctor and the child's parent. And so although, and I'm a physician too, I've got, colleagues that want masks and colleagues that do not. So with it so divided, it's like any other, to me, health decision. People can get a second opinion, and sometimes the data or the medical advice is different. And so it falls back to the parent to make the best decision. I've also heard from many parents whose children are in counseling, and last year was very tough. A lot of mental health medication, suicide, ideation, and attempts, not to mention learning loss, of course. So what I would echo is I know all the people up here are for what is best for children. And obviously you guys are here because of your own children or grandchildren or people you care about. So when it's this conflicted and divided, and you can have the second opinion, I think we're far enough into COVID, we're getting second opinions and people are looking into stuff, that is like any other decision. I think it's best in the parents' hands.
Mr. Hager, you had a question?
I'd like to amend the motion. Our city and county, state and country is in a health crisis. No one seems to want to try to bring people together. I'm Hager's going to try.
Can't hear.
I'm going to try. And if it passes, fine. If it doesn't, fine. I'm going to try something. I'd like to see mask mandates. I am for parental choice. Please.
Our other option is to have everyone leave. You can watch this online. We don't
Please.
have to have you here.
Please, because the next thing I'm going to say you may not like. So please, I beg you, please. We tried the mask deal for 3 weeks. At the end of 3 weeks, Dr. Barnett, Dr. Wallace would determine whether masks should continue or not continue. If a parent does not want their child to wear a mask, they can submit a letter, I'm going to say, to Dr. Barnett and Dr. Wallace to opt out of their child wearing a mask. There was something else.
Mr. Hager, would you be willing to break that into 2 amendments, the opt-out and the 3 weeks?
I'll opt out after 2 weeks, yes.
No, I mean,
Is that what you said?
having the opt-out as one amendment and having the 3-week trial as another amendment.
Nah, whichever.
Okay.
I think that's it.
Could you repeat? Or may I just ask you a question? You're saying that we would do it for 3 weeks and then it would be Greg and Dr. Barnett's decision whether we continue.
That would be in my amendment. If you all don't like that, tell me and I'll take it out. I don't want to be running over here every week having a meeting. So If you want to take that part out, fine. If you want to just vote it down, whichever you want to do, doesn't matter to me. I'm trying to give everybody a piece of the pie. And maybe I shouldn't. I don't know. But, I mean, look, got this group over here holding up parental choice, and back here family choice, and over here wear a mask. I'm just trying to get to some kind of medium. And if a parent does not want their child to wear a mask, get a doctor's excuse or get an excuse and turn in a letter saying, I prefer my child not wear a mask. And it's been mentioned before, last meeting, we definitely don't want people being picked on or bullied because they have a mask on or don't have a mask on. I'm just trying to reach a midpoint. And maybe it's a crazy idea. I don't know, but anyway.
I'm going to try to repeat those two amendments,
I
and we'll
hope you
see if we
can.
have a second. Let's go with the first one, that we do a 3-week period where masks are required. And at the end of that 3 weeks, and I'm just trying to restate what you said, that it's Dr. Barnett and Dr. Wallace's decision on whether to continue. The other amendment is that parents have the option to, and you said a letter, we might talk about how exactly is the best way to do that, but parents have an option to opt out of the mask requirement. Is that fair? Or do you want those two to travel together?
I believe they should travel together
Okay.
and just vote it up or down.
Okay, there's a motion to amend with those two items, a 3-week with Dr. Barnett and Dr. Wallace making the decision after that, and a parental opt-out. Is there a second for that amendment?
I'll second it.
Discussion.
Yes. Besides this, I'm not sure, Mr. Hager, how that's any different than now. If parents are, we have some parents opting out. So I'm not sure that it's any different from our current policy.
Well, one difference would be that faculty and staff would all have masks on, and that would be a pretty big difference. And that
You're
can-
saying that would be a requirement of all staff, teachers, principals? Is that what your motion was, Beth?
Yes, everyone in the building.
Mr. Williams.
I'll make a comment. I too want to thank everybody for all your emails, your phone calls. I've read them all. I've read every link that you've sent. We all take this responsibility very seriously. We care about your children. We care about our staff. I understand both sides of the issue. I respect the opinions of both. I understand the public concern, the health concern. I've chosen to be vaccinated. My wife has chosen to be vaccinated because we're trying to do our part. But I've seen the effect that it's had on our children firsthand. I have a child in the system. I have a college-age son who's also has been schooled remotely. And it's been tough. It's been tough on everybody. It's especially been tough on our kids. They've really kind of had the burden of the brunt of it for a long time. And wearing a mask greatly affects them. We've seen depression. It's been really tough for them. And so I agree that it should be a parent's choice. We have seen, the parents and their children have spoken when we've had roughly 80% of our student population showing up without a mask. But I do understand the health concern. I do. I've talked to a lot of friends, physicians. I'm sure we all have. But for me, it's been a real struggle because I I know there's the health concern with the variant, but we could be living this with for a long time. We could have the Echo variant, the Foxtrot variant. This could be going on for years, and it's at what point does it stop? But Mr. Hager, I appreciate your effort in trying to reach a compromise, and maybe this will result in more people wearing a mask that maybe not. But at least it kind of does send a little bit of a message, tries to meet in the middle. And if you don't want your child to wear a mask, they can opt out. And maybe this slows it down. I was surprised, the numbers at some of our schools were really 5 cases for most of them, except for Liberty Bell, Science Hill, and Indian Trail. But anyway, I appreciate you trying to come to a compromise.
Mr. Greenlee, did you have something?
I have something. If we do these things, we need to stay with it and not set it aside to who it involves. If we do it, the protocol should be for everybody, not for a few. Now, I drive a school bus every day. I've been driving for 2 weeks, and everybody had to mask up. That was important, and kids did not have a problem with that. But I don't have a problem with wiring them or don't wire them. It just get the distancing, make sure to wash their hands, and make sure things are in place. But sometimes we avoid that and say, oh, it don't need to be done today or tomorrow or whatever, and change directions. Let's stay with it. I'm for what's good for the kids. That's my ultimate goal, is improve the quality of life for the kids. That's all I've got to say.
Mr. Hager, there's one part of your motion that that is a little worrisome to me. I don't know if we want to put this on Dr. Barnett and Dr. Wallace in 3 weeks to make that decision. I would like to amend your amendment to make it through September 10th, which is about 4 weeks, and we meet before then. So if we need to make changes, we could do that.
Do we just need a second?
You need a second on that. So mine would be the ability for parents to opt out, and I think we should leave that up to our administrators. I think Dr. Burnett might want to do a form and put it on the website so that parents have an easy place to find that. But I'd like to amend the amendment to 4 weeks till September 10th, and that's after our next meeting.
I'll second. Go ahead.
Just one quick thing to that. I agree with not putting that pressure on the two of them, but I also think that there should be something in place that determines that answer. So not a flip of a coin, but is it going to be numbers? Is it going to be more research? What are we going to use to determine that answer? And again, that's not going to be, I don't think that's something that the school board should call. I think someone with credentials should call that.
Can I ask another question? Did we get a second so we
Yes.
have discussion?
Yep.
On the opt-out part, is that you can opt out from day one? You can opt out anytime within the 1 to 4 weeks or 1 to 3, whatever it is. You could choose to opt out at a later date. You wouldn't have to make a decision from the beginning.
I-
Is that
I would say.
how we understand it?
And then I just want to clarify. So I know there's 3 amendments, but the main motion requires all faculty, staff, teachers, students, and the only one that can opt out is a student. Is that correct, Beth?
The parents of the student.
The parents of the student, but no opt out for any reason for faculty, staff, teachers. Is that correct?
That's how I said it. That's correct.
Okay. And while we're discussing this, I guess, so what do, you make sure I'm asking at the right time, Ms. Hall. So what do we do if you mandate something, then you've got to enforce it. So what is going to be done to kids that don't wear a mask to school? I mean, what are we going to do?
What did we do last year, Dr. Barnett?
Last year, if they did not wear a mask, it really wasn't an issue. I don't remember an issue where.
I mean, but they
child
come and they don't have a mask. So what are
Well,
we
you would
gonna
call
do?
their parents, and if the parent says, we're going to opt out, we've opted out, then we would allow them that opportunity under what Mr. Hager is saying.
So form, phone call. If, I mean, I'm just thinking that is, because that's going to happen. So it could be if they say, I don't have to, it's not, I mean, I guess the other question is if they show up, a phone call be made, or they show up and they're asked to put a mask on.
If they're not,
If a student comes in and says, my parents have opted me out, then you would call the parent at that point.
Can I ask another question?
Mhm.
What about stigmatizing the young people? Like,
What
my
if,
kids are very afraid of acting, looking weird with most of the kids. and they're the
I'm
only
sorry,
kid
if you
without a
don't,
mask. I will leave after this, but I have to ask you, because my kids didn't want to wear a face shield last year because they were the only kids wearing a face shield, and they didn't want to be the weird
I'm going to have to
kid
ask
in
you to
the
leave.
class.
I'm going to have to ask you to leave.
I will, but I want you to know the kids don't want to be separated and wear a star to
If-
school.
If we
So
have
opting
a,
out, these parents will opt out, and none of the other kids will.
Sir, I'm going
Because
to,
their parents
I'm
aren't
gonna-
even here.
I'm going to ask you to leave.
I will leave now.
if a,
Oh, we did it
if a
last
teacher,
year.
Please.
They are
a faculty
crying
member,
because They love Indian Trail. They love Town Acres, and they're very sad that they won't be able to go anymore. And I'm sad too, because I don't want to give you my taxes anymore.
if we have a teacher, faculty member, support staff that has chosen not to wear masks, maybe they've been vaccinated. Your motion is that we're requiring all.
That's correct, because I have a daughter who cannot be vaccinated yet. And so, you know, at this point, I would feel better if everyone had a mask on. You know, we're doing that for the benefit of our kids.
What about us?
You're not thinking about everybody. It's paid doctor.
And I just want to, this is where my heart is in this entire conversation. Excuse me, I appreciate some of your emails. I'm going to be honest. Some of them are pretty brutal, but I appreciate the concern and issue. But what I don't hear, excuse me, please. What I don't hear is that what I don't hear is the conversation for all students. I'm concerned about our staff, our principals, and our teachers. There's very little conversation about all students, which is what this board represents. Everyone has their own children, and it's very clear with the guy that mentioned that your conversation is for your child. But what about the other children? And I think it's important, again, this is my heart. I think it's important that we understand that this board is speaking for all children, all staff, all faculty, everyone, not just individual kids. Again, and please do not applaud for me because I'm not here as a celebrity and all of that. I just want understanding for all. Thank you.
If there is any more outburst, I'm going to recess the meeting. We're going to ask you all to leave except staff and reporters. And then we'll come back and finish our business.
I just want to apologize for being personal there. There are children in our schools who are not vaccinated. And so my concern is for those, especially for those K through 6th grade kids who have not had the opportunity to be vaccinated. And frankly, that is Liberty Bell and Indian Trail is where we see the most spread right now.
Other discussion? Okay, so go ahead.
Oh, I'm sorry. Dr. Barnett, do you have any concern about with the mask mandate that you may have teachers that are not willing to wear a mask to school?
I think our protocols are pretty clear on teachers, on when they need to have, if they're working closely with students and not. So I would prefer to leave the protocol the way it is. If they're in the front of the classroom, I prefer them to be able to teach where the students can see their face.
Is that
and when
what
they're-
you want in your motion, Beth?
That is not, That's not in my motion. So I would think that would have to be an amendment that we would amend it to be that
The protocols.
the
list-
protocols would stand for teachers when they are in the front of the classroom. I think that's how it's written, that they are allowed to take their mask off. And I think that seems reasonable.
I think it's or in small groups, well distanced.
Yes.
That's already in our protocols.
Yeah. So I think that, lining up with our protocol makes sense to me. So I guess I'll amend it in that way. I guess I would need a second.
Okay, I'll second that. Oh, where's Miss Patterson? I'm trying, okay.
That's the Fourth
So
Amendment.
I probably, because I amended, we're gonna,
Just go back to the first one.
yeah, we'll need to vote on mine that amended Mr. Hager's first, then we can get to yours.
I thought you go 4, 3, 2, 1. I thought you go
So.
the most recent. and
Okay, so,
backwards.
yes, so we climb up the ladder, then we climb down the ladder. The first amendment that we'll be voting on is Ms. Simpson's, who amendment is that we follow the protocols that are listed in our protocols. When a teacher is in front of the classroom or appropriately distanced in a small group, they may take their mask off.
And I just want to say this, if anybody's got any ideas, but I've just said I'm not for mandating masks for our teachers, but it makes it difficult to know how to vote for amendments when you're not for the original motion.
That's a
You know?
good point. And so it is important for all of us to
Yes.
know, you can be in favor of the amendment
Right.
and vote no on the original motion.
So, yes, thank you. I just, because it gets confusing. So, so I guess the vote would be in case the original motion passed. How would you want that amended? I don't know. Okay.
Ms. Hall,
Yes,
I'm not sure there was a second on the last.
I seconded.
I think she did. Yeah, somebody did. So to clarify, basically the amendment is you're going by the protocols that Dr. Wallace said is in regards to teachers. How about other staff though, like janitors? I mean, I don't know. I mean, does it, I don't think it said, it just talked about teaching. Are we expecting everybody else to keep it on full time?
Yes, because I think the point is it's for instructional purposes that we would take the mask off.
So that's your amendment is for teachers only in this protocol.
Yes.
Any other discussion on that amendment? Any questions about what that amendment is? Any other protocol or any questions about how this works? All right, Ms. Bird, will you call the roll?
Dr. Ginger Carter?
This is the amendment
About teachers.
about teachers. To give the teachers a break, I will vote yes for the amendment in case the original motion passes.
Mr. Herb Greenlee?
Yes.
Mr. Thomas Hager?
Yes.
Ms. Kathy Hall?
Yes?
Ms. Beth Simpson?
Yes.
Ms. Michelle Treese?
Yes.
Mr. Robert Williams?
Yes.
Okay, so that amendment passes. The next amendment is my amendment to Mr. Hager's amendment that extends the trial period to September 10th. And
Didn't you say that we would meet and decide about it
yes,
rather than?
so it's after our next meeting. So the trial period goes to September 10th instead of 3 weeks, so that it comes back to us at our meeting. Okay, is there any discussion on that amendment? Ms. Bird, will you call the roll?
Dr. Ginger Carter?
No.
Mr. Herb Greenlee?
Yes.
Mr. Thomas Hager?
Yes.
Ms. Kathy Hall?
Yes?
Ms. Beth Simpson?
Yes.
Ms. Michelle Treese?
Yes.
Mr. Robert Williams?
Yes.
Okay, so then we go to Mr. Hager's amendment of the original motion, which was to have a trial period which now lasts till September 10th after our next board meeting and allow for a parent opt-out.
but would require the teachers, except for instructional time, and would require all staff.
Yeah, so all the amendments,
I said anyone in the building. So I think it would even be parent volunteers, which is already in our
Yeah,
protocol
it's-
anyway.
So,
okay, so this amendment that we're voting on is the amendment to the original motion, which we'll do next. But this amendment says that there's a trial period of 4 weeks of
well, that's already
Of-
passed,
yeah.
right? Okay. So you're just.
that part, yes,
right.
but just because we extended it to 4 weeks doesn't mean that part has passed. So a trial period of 4 weeks and allows parents to opt out by written consent. And we'll let perhaps our schools and our administrators figure out the best way to do the written consent. All right? Yes,
So when you say parents can opt out, you're saying the parent can opt their child out or children out. But if the parent is a volunteer to the school, does this
they still have
protocol?
to, they still have to wear it.
And then the other, was this opt-out a period, would start on Monday?
We haven't talked about that. I would actually recommend we start on Tuesday to give Monday a chance for people to
Fill out the opt-out.
to fill out the opt-out forms. I don't want to have a chaos Monday morning.
Well, I mean, I would recommend Monday. If it's opt-out, it's opt-out. It's 90 degrees outside.
So
But
you're saying we
I'm
would have
saying-
a form stood up this weekend and have parents be able to fill it out and ready by Monday?
I'm saying that the requirement starts Tuesday.
Would start Tuesday.
Oh,
And let-
I'm
allow
so
them to
sorry.
opt
I was
out
like, if
Monday.
parents don't
Yeah.
want to opt out, they'd want to opt, I see what you mean.
So-
Okay.
Rather than start Monday, okay?
Okay, so this is the opt-out option. Okay.
This is the opt-out and 4-week trial period. Ms. Byrd?
Dr. Kendra Carter,
Yes.
Mr. Herb Greenlee,
Yes.
Mr. Thomas Hager,
Yes.
Ms. Kathy Hall,
Yes?
Ms. Beth Simpson,
Yes.
Ms. Michelle Tree,
Yes.
Mr. Robert Williams,
Yes.
Okay, that brings us to the original motion, which is Ms. Simpson's motion, and it is to require masks on our students and our teachers with the exceptions that we've just voted on, and allow parents to opt out as they choose by written consent for a period until September 10th. Any other discussion on that?
I do want to clarify this. So it's, obviously, and I appreciate Mr. Hager. I know he's trying to make everybody happy and give people some options. But in the end, I'm just not for mandates. I don't think that's our job. So I appreciate that you have given somebody the chance to opt out, but my no vote will be that I'm not for mandates.
All right. Any other discussion? All right. Ms. Byrd, will you call the roll?
Dr. Kendra Carter,
No.
Mr. Herb Greenlee,
Yes.
Mr. Thomas Hager,
Yes.
Ms. Kathy Hall,
Yes?
Ms. Beth Simpson,
Yes.
Ms. Michelle Tree,
Yes.
Mr. Robert Williams,
Yes.
Okay, that passes. So beginning Tuesday,
Okay.
do we need do we need a motion on the Tuesday start date, do you think?
I think, do you want to leave it up to Dr. Barnett about
So
how
to-
that's done?
To clarify this, it's still recommended. We're still under recommended until Tuesday. So we would have an opt-out letter on our website, or we'll get something together, get it available.
Do you think you could have that by noon on Monday?
I think we can get it ready. We'll probably do it this weekend, get it ready. And that way, people can have that, so they can turn that in and make that option.
And do you think it's best they turn that in at school?
I do.
Okay.
I think it's much better for the school to know if, then, it's the hardest place it's going to be to put in place is the high school. The elementary schools, the parents, you're in a class, you got a homeroom, you've got groups. I'm just telling, that's the thing. The high school will be the most difficult of those. But it's doable through homerooms. We could do that. I like to work with Dr. Carter, Josh Carter. on what we'll do at the high school. And I'll work with the principals on that. We'll work through that, and we'll have a form that is used across the system. We'll get that ready so we can carry out this procedure and policy.
And how will we communicate the 4-week requirement?
Well, so 4-week requirement, like Mr. Williams said, so you got a parent that wants their child to wear a mask. They wouldn't fill out the form. But in a week or two, the parent does, then the form's still available, then they can fill that out at any time. That's in place, right? So they could do that. So we will.
I'm just thinking, are you going to use school messenger to
We're gonna,
communicate this? Or are you going to?
We're going to use school messenger and our website. But we'll have them available. We'll have to have them available also for somebody that doesn't want to print it out and send it to us. So we'll make it as easy as possible for the school, for the teachers, and for the parents.
And we're going to communicate just the change in general.
It's just a change in general that occurs. And the biggest piece, I think we need to make sure people understand, this starts Tuesday, not Monday.
That's correct.
So we'll get that out and communicate it, and we'll get it ready. I don't know how long it'll take, but we'll get it ready and get it on the site. So if somebody wants to start turning it in Monday, they can.
Okay. Dr. Carter, you have?
Yes, I just want to be sure on Tuesday, just because some parents may not get the communication or have as easy access to print the form. I just want to be sure if a child shows up without a mask, that the principals understand,
Sure.
what to do and
Okay.
to ask.
That's a good
And
point.
I don't want a child to feel embarrassed either way about what to do, and that we just contact the parent.
Okay.
If you think that is what you would suggest.
It is. That's what we would do anyway. Mr. Carter, do you have any, or Dr. Carter, do you have any other? You think we would just contact somebody, call a parent if the child had a question about it? We'll work on that, and most of the principals are able to be here, so they've been part of the meeting, so we'll work through that.
And I assume this goes without saying, if a student is 18 years old, they get a chance to opt out themselves.
That's true.
All right. Any other discussion? Mr. Greenlee?
What about the kids that are riding the school bus? They don't get to opt.
That's right. The bus is still,
They do not get to
yeah.
opt out.
That's
yeah,
a good point. Thank
that's
you.
federal mandate.
So, but the buses will continue as they have been with masks required.
All right.
All right. Anything else?
Uh,
Mr.
I do.
Hager?
I didn't come to this conclusion on this issue.
Just bring it closer. There.
I didn't come to this conclusion by myself. I have a friend who's an infectious disease doctor, and I've been talking to him for 18 months, pretty much on a weekly basis about this. In no way am I telling people what to do in any way. But until this area gets serious about this virus, and I think Mr. Williams made reference to this, it is going to be with us in some form. This region, which I think extends down to Morristown this way, one county, 25% of the people have been vaccinated. I think Washington County leads this region. Maybe Dr. Carter knows this. I think we're about 52%. And my concern, I've got grandchildren. They both have been, or both have had the virus. As you can tell by looking at me, I'm not a young guy. I don't want the virus. And I'm doing everything I can to keep from getting the virus. I'm like Mr. Williams. I have As soon as Tom Hager could get the vaccine, I got it. My concern is I've missed 3 Army reunions. I'm a Vietnam veteran. My guys are dying. We're dying faster than, and I didn't mean to get off on this. I can't stand it today. We're dying faster than any veterans have ever died in the history of this country. You don't know unless you've been where I've been what seeing a brother means. You know, Miss Hall, you live with one of them. We have a bond. I cannot describe it. I do not know a lot of these guys I see at reunions. But as soon as we see each other, we hug each other. We say the magic words for Vietnam veterans. Welcome home, brother. I want personally, and this is personal, I want to be able to go to my first Cavalry reunion in September and see my brothers one more time. And I believe in people having choices. We are in a health crisis. If we don't do something about it, as individuals and then as a group, this is going to be with us. And that's all that's the only place I'm headed with this. And talking with my doctor friend, if we don't get serious about the vaccine, don't get serious about being 3 feet apart and all these good things, I'm afraid this is going to be with us. That's just where I'm coming from.
Mr. Hager, thank you for your comments and thank you for your service. We appreciate that. Now is a time to applaud. And Dr. Barnett, I want to thank you for your leadership, and I want to reiterate that the reason we're making these decisions is because we care about kids, and it's a discussion, and if we all had the same opinion, there'd be no reason to have a board. So it's good that we all bring our own thoughts and backgrounds and ideas, and what we all really want to do is keep kids in school, because kids belong in school, and that's really our goal. So we're doing what we each think is best to make that happen. So thank you all. Thank you as a board, and we are dismissed.
Happy, good job.
Thank you.